So the first setup is an AS occiput. So your contact point is going to be the base of the occiput. You're going to contact with your inferior hand. Your superior hand is going to be placed on the upper thoracics. Your doctor's contact point is going to be the thumb and the MCP or the PIP, and you're going to hook that in and under the base of the occiput. So your stabilization hand is going to rest nicely on the upper thoracics. You're going to do an I to S tissue pull from C3 up and then under the base of the occiput. You're going to keep your body nice and low and your forearm, forearm nice and low as well, so that you're getting a lot of I to S in your line of drive, but also the ability to do A to P scoop. And your stabilization hand is also going to be a thrust, so it's going to be 50-50, where you're going to go S to I and P to A. So it's a double hand motion like this. So this is what the adjustment would look like for a left cervical syndrome if we found a tender nodule, say at C6. So my contact point is going to be the MCP of my superior hand. My contact point on the patient is going to be the LPJ of C6 on the right. My stabilization hand is going to be cupping the air. It's not going to be flat, suctioning the air in the ear. So it's going to be cupping over the ear. You're going to get nice and low because you want to tissue pull from L to M onto your contact point, L to M, P to A, and your line of drive is going to be P to A, L to M, and I to S for a level of C6, and your thrust would be that way. With this one, it's important, and with the AS occiput, it's important that you say, for this adjustment, I would get the patient to close their mouth and keep their mouth closed for the duration of the adjustment, as the table is going to drop with the tongue behind their teeth. So the adjustment for an AI sacrum, you're going to stand on the opposite side of involvement, and your contact point on the patient is going to be the sacral notch. You're going to use your pisiform of the inferior hand as your doctor's contact point. Your stabilization hand is going to be over the medial PSIS on the side of the contact. So it's not on the opposite side, it's on the same side of the contact. So you're going to find the sacral notch, do your things to find the right place, hook your pisiform in, place your stabilization hand on the medial PSIS. The key important thing with an AI sacrum is that you get your elbow lower than your contact point. So you're going to need to really bring yourself over the patient. So stabilization hand over medial PSIS, drop your elbow low, and the torque is going to be in this direction, as though you're hitting somebody or you're talking towards their spine or towards the person's head. So sacral notch, pisiform, stabilization, drop the elbow lower, and then it's a whole this direction for the adjustment. So now we'll do the rotated sacrum. So you've done sacral restriction and you have found that the right leg is higher than the left leg. So you have crossed the lower leg or the involved leg over the uninvolved leg. So we've crossed the left over the right. So we have two ways that we can adjust this. So we're standing on the side that the sacral apex has rotated to. So that's the high leg side, which is the right. So we can stand square on and hook our pisiform onto the right medial PSIS, and then hook our left hand pisiform onto the sacral notch, and then we're going to pull on the right medial PSIS, and we're going to push on the right sacral notch. So my hands are kind of going in this direction. So we can correct it that way. We can also take an alternated stance where we're more fencer stance on the side, where I can again contact the sacral notch with my pisiform with my right hand, and then get my left hand pisiform to the medial PSIS, and same thing, we're still going to rotate in the same direction. We've just now altered our stance slightly. Right, lastly is our posterior sacral apex. That's where we're going to contact on the superior aspect of the S4 tubercle. Our line of drive is going to be P to A and S to I, and we can stand in either facing up the table or down the table. So if you're facing up the table and you've got the heel of your hand as your contact point, You need to bring your body forward so that you can still drive S to I, and a lot of your thrust is going through from your stabilization hand in an S to I direction. Or you can stand towards the feet, same thing, heel of the hand at S4 tubercle, and again you're going to bring your body back so that a lot of your line of drive is S to I down the table.